Welcome to the Optimus Health channel. In this video, we are going to talk about urinary frequency causes and signs. Make sure to hit that subscribe button for more videos like this. First, what's urinary frequency? Urinary frequency is the number of times a person urinates in a day. It can be an indicator of health problems and disease. Urinary frequency is often characterized as the number of times a person urinates in 24 hours. An estimated 1 in 3 adults has a urinary frequency ranging from 4 to 9 times per day. The amount of urine a person needs varies from person to person. However, most healthy adults need to urinate 4 to 5 times per day. Urinary frequency is a symptom that can be caused by various health conditions. It can be a sign of many different medical problems, including urinary tract infections, diabetes, prostate enlargement, and more. These are the common causes of urinary frequency. Number 1. Diabetes. Diabetes is a condition that causes the body to produce too much sugar. Your body responds to this by urinating more frequently because excess sugar in the blood can cause dehydration. A person can also experience a sweet, fruity smell on their breath and increased thirst as they urinate more often. When there is too much sugar in the blood, the kidneys cannot filter it all out, and some gets into the urine instead. This causes people with diabetes to urinate frequently because their body cannot get rid of all of the excess sugar through their kidneys as quickly as it should be able to do so. Number 2. Prostate enlargement. Prostate enlargement is a common condition that can cause urinary frequency. This medical condition can be caused by a variety of factors such as aging, obesity, or cancer. Thankfully, there are treatments for prostate enlargement that can help relieve the symptoms and reduce the risk of infection and illness. However, if symptoms worsen or blood in the urine develops, then a doctor should be seen immediately for diagnosis and treatment. Number 3. Bladder problems. The bladder is a hollow muscular organ that stores and releases urine. When the bladder fills with urine, the brain sends messages that it is time to urinate. One of the most common causes of urinary frequency is a urinary tract infection. The bladder is a muscular organ that stores urine until it is eliminated from the body. Many factors, including diabetes, can contribute to bladder problems. They are frequently associated with symptoms such as urinating in pain or increased frequency. The bladder is located in the pelvic region, and it has a capacity to store about 500 milliliters. Number 4. Urinary tract infection or UTI. A urinary tract infection or UTI is an infection that originates in the urinary tract. The most common cause of UTI are bacteria, but there are other causes including a sexually transmitted disease, kidney stones, and prostate infection. Symptoms of UTI include burning and pain or pressure in the lower abdomen that worsens when standing. UTI is a common infection in the urinary tract and can affect the bladder, urethra, and kidneys. It also causes a lot of pain and fever. Number 5. Kidney problems. Kidney issues can cause you to urinate more than usual. The kidneys filter your blood, removing waste and excess water. If the kidneys are not working properly, they will release these substances into the urine, causing you to urinate more frequently. Some of the symptoms include an intense urge to urinate, extreme thirst, and feeling tired all the time. Number 6. Change in your diet. A change in your diet can cause a person to urinate more frequently. This is because the body needs to expel excess fluids and eliminate waste quicker than usual. Eating foods with high sugar content or drinking too many caffeinated beverages can also trigger this effect. A diet high in salt and processed foods can lead to fluid retention, which in turn leads to urinary frequency. Now we are going to talk about the common urinary frequency signs. Urinary frequency is the need to empty the bladder more than 8 times in a 24-hour period, and these are the common signs. The first sign is a need to urinate urgently or with little warning. A common signs of urinate are urgency and frequency. The urge to urinate may be sudden or it may gradually come on with increasing urgency. Learning to recognize the signs of urinary frequency can help identify a health issue. The second sign is to do many trips to the bathroom, even if the bladder is not full. The frequency can range from needing to urinate every few hours to as many as 50 times per day. It's common for people with urinary frequency to not feel like their bladder is full enough, even if they really are. There are a number of reasons why people may not have access to a toilet when they need to relieve themselves, such as a person needing to use the restroom at an inconvenient time, being in an unfamiliar area, or too far from the nearest facility. This can lead the person to hold urinating and risk their health. Number 3. Waking up at night to urinate. Urinary frequency, or needing to urinate more than once a night, is common and can be caused by a variety of factors. One of the most common causes is dehydration, which can be caused by not drinking enough fluids throughout the day. It can also be caused by constipation if you've been having trouble going to the bathroom. This condition may also be due to an infection with the urinary tract. Number 4. Lack of sleep due to a strong urgency to urinate. When someone cannot sleep due to a strong urgency to urinate, is a common sign that they have an overactive bladder. The bladder becomes overactive when it contracts too frequently and/or empties too quickly. A person with an overactive bladder often feels the need to go to the bathroom more than once during the night. The most common reason for the inability to sleep is a strong urge to urinate. This is called nocturia. Number 5. Inability to hold urine long enough for a restroom break. This is a common sign of an underlying condition such as stress, anxiety, depression, or a neurological problem. A person may not be able to control their bladder due to other factors such as obesity, pregnancy, or even anxiety. In the elderly, urinary frequency can be caused by prostate enlargement or medications. Number 6. Pain when urinating. There are many signs and symptoms that can indicate a problem with the urinary tract. A burning sensation when urinating is one of the classic signs of a urinary tract infection (UTI). Other symptoms include fever and pain in your lower abdomen. A cloudy or smelling urine are another symptoms of UTI. Number 7. The feeling that the bladder never empties completely. When the bladder never fully empties, it can signal a problem. The feeling is often described as an uncomfortable pressure or a constant need to go. Sometimes called overactive bladder, the condition is often caused by a neurological problem that interferes with the signals between the brain and muscles in the bladder. People who have an overactive bladder often have to go to the bathroom many times a day or experience urinary incontinence. In conclusion, urinary frequency is not always caused by a disease. The feeling of constantly having to urinate can be caused by excessive fluid intake, caffeine, or even a bladder infection. If you're experiencing these signs, it is important to see your doctor to ensure nothing serious is going on. Thanks for watching. Don't forget to check out our other videos on the channel and subscribe to be part of the family. Turn on notifications so you don't miss anything. Remember to stay strong and live long. I'll see you in the following video.